Okay, hello everyone, and thank you so much for joining us. I am Bethany O'Connor, and I'm delighted to welcome you to today's watch party for the short film, Why Policy Matters, Reforms Lead to a Healthy Outlook for Nigerians. We have a great broadcast for you today, and we just want to begin by saying that we're just watching the events unfold in Nigeria with the violence against those who are peacefully protesting against police brutality, and our hearts go out to you. It's a very difficult time, and we're just thinking of you. So we're going to begin with just a few announcements before we dive in. This webinar is being recorded, and we can make it available for you within the next week. Also, these web conferencing platforms are getting a high volume of traffic, as you can see these days. So we just ask you to bear with us in case there are any glitches with the technology. We'll get it back up and running as soon as we can. We also ask everyone to please mute yourselves when you're not speaking, so we keep the line nice and quiet. And we would love to hear from you, and we welcome your questions at any time. We're doing it a little different this time in that we're asking you to submit your questions via email to bethany.o'connor@thepalladiumgroup.com, so I can consolidate all of those without all the chat notifications popping up. And then Dr. Francis will read them aloud and when we moderate the discussion. And I'll put that email address up in the chat box as well. So in terms of the flow for today's watch party, we'll start with an introduction from Dr. Jay Gribble. Then we'll screen the actual video, which is about 5 minutes in length. Then we will have a panel discussion moderated by Dr. Francis Alika, and then we will close. So we just have a great broadcast for you today. And again, we're just so excited that you're here with us today. So with that, I'm going to turn it over to my colleague, Dr. Jay Gribble, our Deputy Director of Family Planning and Reproductive Health. Jay?
Thank you, Bethany. Good morning and good afternoon. I'm pleased to introduce to you a new series that highlights why policy matters to good health. So often, people go to a clinic or to the doctor when they need care. They get medicine and the services they need, and their issue gets resolved. And that's great. That's the way it should work. But let's take a step back. What about the treatment guidelines? Who employs the doctors and nurses and makes sure that they're qualified to care for patients? Who establishes the priorities that make health services like antenatal care, immunizations, HIV testing, or access to family planning available for people to attend in the first place? What lays out how the Ministry of Health is structured and how civil society can play a role in influencing the health agenda? Well, I tell you, it's health policy, operating behind the scenes, establishing quality programs based on international norms, mobilizing resources to pay for services and salaries, and ensuring that the right quantities of medicines and supplies are ordered and on hand when needed. All of these things that we take for granted don't just happen magically. They result from a solid enabling environment for health, and that is why policy matters. Today, I'm pleased to introduce one of the experiences that the Health Policy Plus project has had the opportunity to support. Nigeria is a large and diverse nation with a population of almost 200 million people. Responding to the health needs of these people is a challenge, but two health policies are now being translated into actions, and we are seeing results. One policy, primary health care under one roof, and the second policy, Basic Healthcare Provision Fund, are being rolled out throughout Nigeria with results like improved facilities, better access to quality services, the availability of medicine and supplies, all without putting people in financial hardship. Through these policies, Nigeria is on its way to achieving universal health coverage. I'd like to introduce our three presenters today. Dr. Francis Alika is our Country Director for Health Policy Plus in Nigeria. She has experience in health system strengthening, including health financing, governance, human resources for health, and service delivery from a clinical and public health practice. She has experience also facilitating the establishment of multi-sectoral coalitions that included the financial sector, parliamentarians, private sector, civil society organizations, as well as the health sector, all focusing on universal health coverage and the Sustainable Development Goals. Joining Francis is Dr. Babatunde Amole, who is a health promotion and development expert, focusing on public health and development. His experiences include program management, strategic planning, capacity development, and youth development. He's the founder and executive president of Garnet Youth Development Foundation, a frontline NGO in southwest Nigeria, working on youth development and health for over the past 15 years. And our third speaker is Dr. Olugbenja Bejide, who's a public health physician, a management consultant, and a health reform advocate. He's currently chair of the FCT chapter of Health Reform Foundation of Nigeria, HERFON, which is a not-for-profit, non-governmental organization committed to health reforms in Nigeria, especially through primary healthcare under one roof. Before we hear from our panel, let's take a few minutes to watch the video and learn how reforms are leading to a healthy outlook for Nigerians.
And thank you for tuning in. We have to apologize for the technical glitches, and we hope that you were able to get the substance of the message that we have in this video. So this video is actually showing a situation in Nigeria where we know that Nigeria ranks very poorly with regards to health indices, and including childhood, maternal, and infant mortality rates. And the health system is plagued with a lot of issues across the health system's building blocks, ranging from poor financing, especially at the primary healthcare level, poor human resources for health, poor governance, and issues with infrastructure and health management information systems. And these issues have actually contributed to a large extent to the poor indices that we've seen with the health system. So as a result of this, a lot of efforts has been ongoing with regards to how do we address these issues. And then came the Basic Healthcare Provision Fund, which is considered as a game changer, and it's to stem from 1% of the consolidated revenue fund of the Nigerian Federation. And this fund is to go to states to support both demand and supply side health system strengthening measures. From the demand side, it's supposed to remove financial barriers to people accessing care. I'm sure that we could see from the video, the man who was talking about how he's able to go to the health facility and access care without having to pay anything. Because these financial barriers have held people back, especially the poor and vulnerable people, from accessing good health care. And these have actually contributed to the bad indices that we have. On the other side, which we like to call the supply side, the Basic Healthcare Provision Fund has actually strengthened the primary healthcare system by making sure that facilities have good infrastructure, human resources for health, are able to access drugs by funding them, providing direct funding to these primary healthcare facilities, which for a long time they haven't been able to have. So as a result of that, in these facilities, you have that they're able to procure drugs, stock their drugs, have basic equipment to provide quality services to people, have human resources for health who are motivated to work, and then have the basic infrastructure, including the hospital beds, electricity, water that they need to provide quality care to people. So when we have these things available in the facilities and we have the financial barrier to accessing care removed by taking away the out-of-pocket payment, of course, we have a very bright situation where people can actually walk into these facilities, have access to good quality healthcare that is adequate enough to actually give them good health outcomes and then improve on the health indices. So that, in a snapshot, is what the video was trying to show with regards to what is happening with Basic Healthcare Provision Fund. And the Health Policy Plus project, we are actually quite fortunate to have supported this reform in Nigeria together with other partners and the government funded by USAID. We were able to provide support across board, from the federal level to the state level to the community level down to the facility level, to support all the different structures that needed to be strengthened to make sure that this intervention, which has been identified as a game changer, is actually effective in changing the narrative in the Nigerian health system. And today I have with me members of the civil society. And we thought it was very important to bring people from the CSOs to actually talk about the impact of this basic healthcare provision fund on the communities, because that is what is the most important. So I would like to welcome other members of the panel. They have earlier been introduced by Jay. So we have with us Dr. Oluboyinka Bejide, who is the FCT lead of the Health Sector Reform Coalition, who has played a very big role in the implementation of the Basic Healthcare Provision Fund. And we'll be hearing from him firsthand about the progress, the whole journey of the Basic Healthcare Provision Fund, as well as the impact that this is already having in the communities and in the population. And then, of course, we also have Babatunde Omole, who is actually a youth activist, and he heads a youth CSO called Garnet Youth Development Foundation in Osun State, one of the states that have actually benefited from the implementation of the Basic Healthcare Provision Fund. So welcome, panelists. And my first question would be, you know, from what we've seen in this video, I'm sure that everybody's moved, you know, about this great reform and the potential that it has for the Nigerian people. So how do you think these reforms have helped to strengthen the Nigerian health sector? And what is the importance of this as we try to continue to battle COVID-19 in Nigeria? Dr. Bejide, please, if I may start with you. Are you there, Dr. Bejide? Could you unmute yourself, please? You're muted, sir. Can we move on quickly to Babatunde while we're waiting for Dr. Bejide?
Yeah, good afternoon,
Babatunde,
everyone.
please could you share with us? Thank
Good
you.
afternoon, everyone from Nigeria. I'm pleased to be part of this program to actually speak to the giant stride that have been made in terms of health policy reforms in Nigeria, which has practically translated into improved health indicators in Nigeria. So I want to say a very big thank you for HP Plus for having me. I want to say a very big thank you to all the stakeholders for making sure I'm part of this to come and share experiences. According to WHO, if you look at it critically, according to their ranking, Nigerian rank 187 out of 191 country in terms of health care service delivery. And when you look at our national demographic health statistic of 2013, you realize that Nigeria still has up to now a maternal mortality rate of 576 to about 1,000, and under 5 mortality of 69 to 1,000 live births, and life expectancy is 52, and antenatal attendance is still remains 61%. And when you look at a delivery by skilled health worker is about 38%. All these are not very good health indicators or health indices for us as a nation. And it has taken a toll on some other aspects of our life, from social to economy and to health. And when you look at it critically, you realize that most of these indicators that are not favorable to us as a nation are actually brought about because of so many issues that have been on ground for a very long time. And one of the critical issues we have to look at is the issue of poor infrastructures. We have to look at the area of poor coordinating entity. We have to look at the area of lack of consumables, drugs, medication for people. You have to look at the area of out-of-pocket payments. And you know, predominantly, most of our people that are living less than $1 in a day are predominantly over 60% of the total population. And this has made accessing health facilities to be very, very difficult for our people. When you look at the issue of accessibility, the issue of funding, the issue of coordination, these are what has been directly linked to all those poor health diseases that we have. So when you now look at the policy of primary health care under one roof, and you look at it holistically, you know that that's actually trying to address the issue of access, the issue of quality and service delivery, the issue of making sure the capacity of the entity called primary healthcare services are actually built so that populace can enjoy good quality healthcare services. The same thing goes for basic healthcare provision fund. Basic take care of the financing of out of pocket, take care of capacity development of health workers, and in our own case in Osun State, which I'm part of the formation of and all the agencies that are responsible for primary healthcare service delivery, the health insurance, of the capacity building of WDC, capacity of healthcare workers, and so on and so forth. We realize that over the time we have been getting very positive testimonies, and we now realize that in most of our health facilities now, our health worker capacity are well built. The human resource for health is actually developing, and we have all those facts and figures. About last week, I still have a testimony that I had to share with the Commissioner for Health, share with a Chief Press Secretary of the state, and share with Director of Primary of Research and Statistics in the Ministry of Health. There was a lady that had to go to healthcare facility just because he wanted to listen to what they have been saying and prove it wrong or right. And at the end of the day, he got all the services delivered within 10 minutes. Out of all those focal health facilities, we have been able to build their capacity. They now have access to their revolving drugs. They have access to do basic things and all the utility that needed to be paid. So in a nutshell, when you look at it, even though I don't have anything empirical now to actually show the statistics that there has been tremendous improvements, but we do an ISS, integrated support supervisory visits to some of these health facilities, and we have been able to deduce that things are not the way it used to be before BSCPF came into the state and before we started implementing primary healthcare under the RIP. These have changed the structure of governance. It has empowered and state primary healthcare board. People can now access services and try as much as possible and get possible feedback. And strengthening of the WDC too has made sure that getting them involved has increased the uptake, and people can now access services freely, getting information from their local health facilities. Thank you.
Thank you very much, Babatunde, for that. And I would like to move on very quickly to Bejide to add to that. Babatunde has actually outlined some very important impacts that has been seen even from the community level, talking about improved governance of the structures that are responsible for providing healthcare, talking about improved access, reduction in out-of-pocket expenditures, and strengthening of local capacity to actually implement this. So I'd like to move to you, Dr. Bejide, to really share with us also your experience on how the communities are actually seeing this initiative.
Thank you very much. Are you hearing me?
Yes, we can hear you.
Hello.
Go ahead, Dr. Bejide.
Yes, thank you very much. One greetings from the city of Abuja. We're in the Federal Capital Territory, and my colleagues are already in summary what is spoken before the lead. The only other thing I would just like to emphasize is the fact that there is now better coordination. If you look at the objectives of the primary care before, where different structures were doing different things, now we have a proper coordinated system of one management, one plan, and one MIE. That has really helped to integrate all the required FIEs into the same delivery point. So that's an important point I would like to mention. Otherwise, my colleagues have already mentioned the areas of how we have gotten improvements in the health sector reforms. Thank you.
Thank you very much, sir. So I would like to actually acknowledge a very important point that you raised, which is with regards to coordination. So before then, there was a lot of fragmentation, but the Basic Healthcare Provision Fund, another thing that it does is to help to strengthen the coordination mechanisms and actually help to pool funds together so that people can actually receive access to care and that we have better efficiency for the funds that we're able to raise. So thank you very much for that important point. I would like to take this good opportunity that we have you here with us to talk about the impact or the role that civil society organizations, as well as civil society members, have actually played with regards to the implementation of this very important reform. If you could share with us very quickly in 2 minutes.
Yes, I'll do that. One of the main issues we have in this part of the country is that our people hardly believe or trust government. When government programs are introduced to them, they doubt whether the programs will last or the programs are really genuine or the programs are desirable. But when the CSOs come, they have better trust in them, thinking that these are the people who understand how they are at the community level and represent them at the higher level. So trust is one major issue that has come up in terms of the role of CSOs to build trust in the people that is for them. The second aspect is to mobilize them, sensitize them to begin to come around and use these facilities. In the past, they thought, well, it's a government program, it will soon die, why will I go there? So sensitization is a major role of the CSOs because the people have more belief in the CSOs than they have in other program agencies. With that, the CSOs have to sustain that goodwill and ensure that the demand is created for the facilities not available, so that program can continue. Finally, the sustainability component, where there's issue of not only demand, also issue of accountability, ensuring that people give account of what they are doing and what they have done. That is a role of the CSO in this program. Are you there, Francis?
Yes, thank you very much, sir, for that excellent response. Hello, we can hear you, Dr. Bejide, and thank you very much for that excellent response, bringing out the key important aspects of CSO's roles with regards to trust, helping to mobilize the communities because they are more likely to listen to the CSOs than to any other person. And I think we had some experiences from this in many states, including Osun State, where we organized town hall meetings using local CSOs that the community members were already used to. So they found it very easy to believe these local CSOs because they are with them, they've been with them, they've implemented other programs with them in the past. And so they knew that they could trust them. And this actually led to a lot of responses from the communities, in addition to the mobilized resources from the Basic Healthcare Provision Fund, which I'm hoping that Babatunde will be able to reflect on as he also addresses this question of the role of CSOs. So we have you, Babatunde.
Yeah, I'm here. Like Dr. Bejde said earlier, the essence of us being part of this program is for us to ensure accountability, to ensure uptake, to ensure mobilization, at the same time to inform people and make sure that trust is built over time. Osun State experience is really a wow experience for us because we realized over the time that when we started town hall meeting, when the capacity of the CSOs were built to actually go to the communities and work, we felt it was going to be a daunting and a very difficult situation to handle. But on getting to the field, we believe strongly that it really made a lot of difference because at the end of the day, we were able to have a relationship with the community because some of us have been working in this community for a very long time. We're able to consolidate on this relationship. We were able to answer their questions, give them the roadmap to what we really want to do. And at some point, we had to establish a very personal relationship for them, just for them to access services. And most of them still call our offices if they are having any challenges, maybe at the facility, maybe with health worker, maybe with something that they don't really understand. So over the time, the mobilization aspects and the uptake aspects and accountability aspects have been taken care of with, with the active involvement of the CSOs in Osun State. And I can make bold to say that we have presence in over 332 wards where we have our focal health facilities are implementing BSAPF for now in the state, even though we have about 800 health facility and health posts and direct. But we have 332 that are actually working, and these 332 are covering almost all the local governments in the states. So that's why I said our role as CSO, we have gone a long way, and we have done a lot of media advocacy, community advocacy, just to make sure people actually know what's going on as regards BSCPF implementation and primary health care under one roof in Osun State.
Thank you very much for highlighting that very important role, Babatunde. And I think Dr. Bejide also mentioned it as well. The role of CSOs is very important for sustainability. You know, in addition to trust, accountability, and mobilizing people, sustainability is very important. And I'll give an example. The HP Plus project is no longer in Osun State, but we could hear Babatunde talking about the fact that because CSOs were involved in this, after the project closed out, the CSOs have taken this on to continue to push for and even implement the support that the communities need for the implementation of this program. So communities are able to reach out to them. Without this, maybe after the project had ended, the communities may not know who to reach out for, and they may feel that the government officials are too far away from them. But those linkages have actually been maintained with the government organizations, the government institutions, both at the state level, at the local government level, and even down to the facility level. But even more importantly, this role of CSOs, who they can always call easily without any fears to say, oh, these are our concerns, this is what we need, the services are good, the services are still coming in. And then this feedback is also related back to the government institutions that are responsible for actually implementing this program. So that actually says a lot with regards to sustainability as well as self-reliance of the implementation of this great initiative, even beyond the presence of the project that supported its implementation. So thank you so much, sir, for highlighting that. I would like to take some of the questions that we're getting from the comments, because we're getting some very important questions from the audience. So a question we have here says, how has the Basic Healthcare Provision Fund enhanced the primary healthcare under one roof strategy? And how do the two work together practically? So any of the panelists could take that, and then I would also talk about this as well. Babatunde, do you want to say anything? Dr. Bejide?
Yes, I'm available. I would like to make a comment on that. You remember, we've always had primary health care in Nigeria, and we have mentioned that one of the main challenges with that primary health care implementation in the country was issue of lack of coordination. So with primary health care under one roof, this was in line for operational efficiency and for enhanced quality of delivery to the eventual target beneficiaries. Now, with the Basic Healthcare Provision Fund, it has gone ahead to use that existing structure to further enhance and strengthen the health sector especially by ensuring financial protection, whereby you are sure that these facilities are available, and you don't have to really an asset. To them are fundamental components of implementation of National Health Act. And that's helped us to see that, yes, truly, like the word you used earlier, you used the word game changer. Yeah, this is really somebody what's happening. If we've never had it so good in the last 30 years in this country. So we are starting a new course completely in the health sector, and these two integrate together at advancing our health sector reforms.
Thank you very much, sir, for those excellent points. And I think I'd like to add a little bit at this point. So the Basic Healthcare Provision Fund actually had a tremendous impact on primary healthcare under one roof, as well as on state health insurance establishments in Nigeria. Because of the Basic Healthcare Provision Fund, a lot of states that hadn't put their primary healthcare under one roof requirements in place, including having a state primary healthcare agency, having the local government health authorities, having ward development committees at the local government, at the community level, had to quickly put these things in place because it was a requirement for assessing the funds, the intergovernmental fiscal transfer from the national level down to the state level. So that was one big gain for primary healthcare under one roof. So a lot of states actually advanced criteria for meeting primary healthcare under one roof as a result of trying to meet the criteria for Basic Healthcare Provision Fund and to assess the fund. So that's one big gain. Now, the second thing is that the structure was actually built in a way that it promotes the principle of primary healthcare under one roof, which is that all primary healthcare systems and governance is through the primary healthcare agency, from the national level to the state level to the local government committees and down to the facility level. And that was how the flow of funds actually went from the national primary healthcare agency to the state primary healthcare agency and then down to the facility level. Now, the third thing that it did was that it strengthened the primary healthcare system through direct facility financing. So before now, facilities were not able to access, basic funds to perhaps repair a leaking roof, ensure adequate water supply in the facilities. But the Basic Healthcare Provision Fund, for the first time, actually made this possible. So primary healthcare facilities were actually able to access funds to improve on their infrastructure, to buy basic drugs, revolve. We heard when Babatunde was talking about how they revolved their drug revolving funds, how they revived it, their drug revolving fund, so that they are able to have access. People have access to drugs, they have these drugs, and then the primary healthcare system became greatly strengthened as a result of this. Of course, the list goes on and on, but for want of time, we won't be able to list it. But just to say that the Basic Healthcare Provision Fund actually had this stimulating effect and a catalyzing effect on improvements in the primary healthcare system and primary healthcare under one roof. In addition, many states actually released funds for the rehabilitation of their moribund primary healthcare facilities in order to meet the criteria for Basic Healthcare Provision Fund. Osun State, for instance, revitalized a lot of primary healthcare facilities with the state government funding. And this is what we mean when we say that the Basic Healthcare Provision Fund is catalytic, because it's money coming from the federal level to come and catalyze even increased spending at the state level. So I would like to take some other questions that we have for the panelists. And so someone asked a question with regards to governance. So, and the question is that what are the checks that are being put in place to ensure that the Basic Healthcare Provision Fund does not suffer governance and accountability issues that have been seen in other health interventions? So any of the panelists can go first.
Okay. From my experience, because I was actually part of the formation of our primary health care board, the state primary health care board, the Osun Health Insurance Scheme, which we call OIS, and some of the technical working group. I'm part of it. I'm privileged to it. And that's one of the key things that have actually made this program a success. CSO were actually incorporated and actively involved right from the planning stage of the implementation of this project. So, and as CSO, one of the key things we look out for in any government program that involves us is the issue of accountability. And if you go through the guideline very carefully, the way it was structured, there is no way anyone could actually play anything in term of fraud or try to take government money with the way it was structured, even to the level of the facility. And one good thing about this is that most of the practitioners, most of the people that are actively involved in the implementation of basic health care provision fund, their capacity were extensively built. Even the capacity of WDC were built the same way we build the capacity of health workers and some other stakeholders in the states. And the issue of accountability and financing are actually one of the key modules that we have to train these people extensively all about. And there is a structure on ground that if you don't do this, you are not going to get this. If you don't take these steps, we are not going to evaluate what you have been able to do over the time. So there is no way anybody could actually dig hand into government money and say, okay, we are not going to ensure accountability. The system is working on its own, and everybody is aware that this is what I have to do and how to go about it. And the feedback is coming from the facility level to the local government, to the state, and to the national. So it is well structured.
Thank you very much, Babatunde. Dr. Bejide, do you want to add very quickly to that?
Yes, very quickly, I just want to add that there's a strong MIE framework in place, and that is key because it ensures that everybody is on his toes, doing what is expected to do, and he knows somebody is looking at him from the back to be sure that he is on course. So that's important.
Great. Thank you very much for highlighting those. And I think, yes, a lot of accountability mechanisms and governance structures were built in, starting from the national level to the state level, to the local government level, to the facility level, and even to the community level. So at the national level, there was the National Steering Committee or National Oversight Committee based on the current revisions that have been made. And then at the state level, there is the State Oversight Committee where you have the commissioners for health, the heads of the key agencies at the state level. And then you have the local government health authorities who would also get reports from the facility level. And then perhaps at the facility level, you have the officers in charge who receive these funds into dedicated accounts. And even the dedicated accounts, they have to develop a business plan. And that business plan would also feed from their quality improvement plan. So they have to identify certain things they are spending the money on for improving quality and access. And this will have to be approved by the primary healthcare agency. And then as they make these transactions, they have to also send reports back to the state level, and then the state level will send it back to the national level, and all these different levels of institutional checks will be in place to make sure that there is accountability. Also at the facility level, the officer in charge is not the only signatory to the account. So we have the Ward Development Committee chairman, who is a member of the community, who needs to sign. And he represents the interest of the community before the officer in charge at the facility level can actually access these funds. And then they also have to account for every fund that they spend, but not just accounting for it, not just financial accountability, but also performance accountability. So you're giving your quality improvement plan. If at the last supervision meeting visits, you were able to meet certain criteria, at the next one, you're expected to improve. For instance, you were seeing 10 women, you were having 10 deliveries in a month. The next time you're expected to, because you've received funds now and you can buy more equipment and you have more hospital beds, you're expected to see at least 100 women and take 100 deliveries. So things like that have actually been built into the structure to make sure that we have both financial as well as performance accountability of this intervention. So I would like to very quickly move on to the next question. And the question is talking about if we could provide further clarification on what the reform was all about, what was happening before, what happened after, and then the role that HP Plus played. So I must apologize, of course, because the video actually presented this very succinctly, and I can also see that Katie has shared the link to a previous presentation which we really dwelt on what we did, you know, the interventions across the different streams, the supply side, the demand side. That was more of from a technical perspective, while this is from a civil society, you know, community perspective to say what impact is it having on the population. But I hope that if you're able to also listen to the video, watch the video later, and then also listen to this, you get more information. But in a nutshell, to say that before now, Nigeria had poor health indices. There were a lot of challenges. One of the major challenges was poor financing of the health system. For instance, the Abuja Declaration said 15% should be dedicated to healthcare, but healthcare was getting on average about 4%. In some states, it's more than that. But of course, there were a lot of issues. Human resources for health were poor, especially at the primary healthcare level. People didn't have good infrastructure, equipment, drugs, commodities. They were in a poor state. And then in addition to that, people could not even afford to pay to access healthcare because access to healthcare was through out-of-pocket expenditures. So what the Basic Healthcare Provision Fund did was that it tried to take away that financial barrier by removing the out-of-pocket expenditure. So people could then walk into these facilities without having to pay. So people are expected, especially poor rural people and vulnerable people, are expected to enroll into the Basic Healthcare Provision Fund. And once you enroll and you're given a card, then you can walk into this facility without having to pay. And then in addition to that, knowing that after walking into this facility, if the equipment, the infrastructure, the human resources, the capacity that you need to provide services to you are not there, then it defeats the aim. So the Basic Healthcare Provision Fund had two arms. So the second arm was to strengthen the primary healthcare system through strengthening human resources for health infrastructure, drugs, equipment, and commodities. So they sent direct financing to the primary healthcare facilities to use and buy these things, improve on the quality of care. So now we have the financial barrier removed and we have availability of services at the facilities so that people could have better access to healthcare, which is expected to lead to better outcomes. HP Plus actually provided a lot of support across all the levels, from the federal level, supporting release of the funds, making sure that the funds move from the federal to the state and down to the facility level, building capacity across board, developing training modules, training over 5,000 health workers across different levels, community levels, stimulating civil society. And that was how we met how we knew, we worked together with Dr. Bejide and Babatunde, getting civil society involved, getting local governments involved, getting this, strengthening the state institutions responsible for doing this, and then working and providing that capacity support to make sure that this was done in a manner that will promote self-reliance. So I hope that by the time you're able to look at some of the other documents we shared, we'll be able to fill the remaining gaps. But we're also happy to receive questions after this. So I think in a nutshell, those are most of the questions that we have received from the audience. So I think at this point, I would like the panelists to just give us a few closing remarks, and then I will summarize. Dr. Bejide, please.
He might be having some technical difficulties.
Oh, okay. Babatunde, please, could you give us some closing statements? I think basically you could structure it around moving forward. What are the things that we need to do to ensure the effectiveness of this program as well as its sustainability?
All right, thank you very much. It's a very good one that this kind of discussion is coming at this time, and my state's Osun State.
You can hear me now?
Yes, we can.
Okay.
Go ahead.
Yes,
sir.
I was saying that the basic has completely changed SNA. That's just my own summary point. Yes, I'm saying that the basic health provision fund and the primary care under one roof have basically changed the health sector in Nigeria. That's my own summary point.
Thank you very much. And over to you, Babatunde.
All right.
Yes,
Yeah,
thank you very much, and thank you for.
All right.
Babatunde, please.
In as much that we appreciate the fact that we have been able to make some tremendous improvements in terms of our health indices and our approach to healthcare service delivery because of the provision of basic healthcare provision fund and primary healthcare under one roof and active involvement of all stakeholders. I think in my own state, we still have challenges with human resource for health. I believe strongly that the essence of putting all these things in place is for us to have healthcare workers that are going to be well motivated and well distributed across the state, irrespective of where the health facility is. So I believe strongly that if government and development partners can help us to actually make sure that we have access to more human resource for health, that will go a very long way. One of the greatest things that has happened to basic healthcare provision fund is the active involvement of World Development Health Committee and at the community level. These people I've never seen that kind of commitment in my life, that kind of approach in trying to making sure that everybody in their community, in their locality actually have access to good quality healthcare services. So I believe strongly that their structure should be institutionalized to the level that most of the political influence on them is going to be a little wane, then they can have an the will to actually carry out their activity. Most of them, they don't ask for money, they don't ask for anything. They do all this thing out of passion. So there should be a way around where we need to really get them motivated the more and make sure that things are really in place with them. Then we have to look at the area of capacity development of our health worker. It should be intermittent and it should go on and on. Then active involvement of we CSOs, we need it. Then the development partners, once in a while, we really want to not to just build our capacity. We know we have taught us sustainability, we have taught us resource mobilization. We know we still have challenges in terms of technical support. And having HP Plus
Could
in
you
Osun
round
State
us up?
actually
Yeah.
help us. So now, please, we want more support from your end. It can be technical, not necessarily material things. We want all this. And once again, thank you very much for the opportunity. I really appreciate it.
Thank you so much, Babatunde, and thank you so much, Dr. Bejide. I think a lot of excellent points have actually come out as a result of this initiative. And I'm actually very happy that we're getting to hear these things from the perspective of the communities through these CSO leaders within Nigeria. So in their words, the Basic Healthcare Provision Fund has actually had a lot of impact in the Nigerian health system by improving governance, strengthening the governance systems across all levels, reducing out-of-pocket expenditures and making sure that people have access to healthcare, good quality healthcare, and also building local capacity at the institutional level, at the facility level, at the civil society level, as well as at the community level through the World Development Committees. And it has also improved coordination of the systems and reduced that fragmentation. And the civil societies have actually played a very big role in this by helping to build trust in the communities, mobilize and sensitize people to actually take benefit of these initiatives that are out there. They're also playing a role in accountability as well as sustainability and the necessary advocacy that is needed. In the future, of course, the CSOs will benefit from increased capacity development so that they will continue to do this because they're going to play a very big role towards self-reliance of Nigeria in implementing this and also ensuring accountability and making sure that we get the results that the BACPF hopes to achieve. I think I would like to end by actually mentioning that the HP Plus project did a modeling to actually forecast the impact of Basic Healthcare Provision Fund on the Nigerian health system. And it's saying that the Basic Healthcare Provision Fund implemented in the next 4 years would actually lead to a 23% decrease in neonatal deaths, a 20% decrease in child deaths, and a 22.5% decrease in maternal mortality. We have this also published on our website, and we'll also be happy to share this information with people. So at this point, I would like to greatly thank the panelists, and then I would also like to thank the people who have tuned in.
1 minute, please. I think the Commissioner for Health in Osun State is raising up his hand. Maybe, I don't know if there's anything important I want to say. Is Rafi Olasokomi?
Absolutely. So we would like to recognize the presence of the Honorable Commissioner for Health in Osun State. Osun State is one of the foremost states for basic healthcare provision fund implementation in Nigeria. Could you say hi to us very quickly before we round up?
Absolutely. Francis, I appreciate you. I just wanted to appreciate the effort of the fund HFG, your role in that, and of course the recently concluded work of Ed Positive Plus in our state. You know, we cannot forget their role in formulating and establishing our social health insurance scheme and what they did for us in our BAC under one roof. So I appreciate you. I align my thoughts with everything that Omade said, as regards our state. And of course, I want to be an Oliver Twist, because the effort of AP Plus and the funding HFG cannot be overemphasized. We still believe we need any USAID funded activity in our state, especially in the area of and training and retraining and all that. We still require your effort in that area. So I appreciate you.
Thank you so much, sir. It's an honor to have you join us, and it was a great honor to have worked with you towards progressing universal health coverage in Osun State. So at this point, I would like to thank the panelists, thank the people who helped to organize this, as well as the audience that have given us their time. Thank you so much, and it was a pleasure to have you all here and share our experience with you. Thank you.